Well, tomorrow's the big day in waiting. It's been almost 2 years waiting for this bilateral hip surgery to take place. It's going to take place at RVH Hospital in Barrie, Ontario. Dr. Vora is my orthopedic surgeon. He's going to use a anterior approach to access the hip joint. It's an approach that I've selected specifically, and he's the surgeon that was determined best at RVH to do the surgery using that particular approach. But today, considering it's one day prior to surgery, I'm fully expecting the pain that I've been experiencing for the last 2 years is going to change. And it will change post-surgery to a different type of pain. But I wanted to talk about pre-surgery pain, because there are really three types. I experienced pain that you would typically associate with osteoarthritis. It was a deep throbbing pain in the hip joint, started with the left hip joint, migrated eventually to the right hip joint as they deteriorated over time. And that was typically described as arthritic pain or arthritic pain. It was deep, felt like it was in the bone. Some days, if we had inclement weather, thunderstorm rolling in, the pain seemed to get worse. But it wasn't the worst type of pain associated with the degenerating hips. The worst pain I experienced was when I did a sudden movement, an unexpected movement. Either at night I would catch my knee in the sheets as I was trying to roll over, or I was doing something physically and had moved my leg into a awkward position where it tore, literally felt like it was tearing the muscles in the groin. And once you did that, the muscles seemed to want to go into a splinting mode. They wanted to try to protect the hip, and they would start to pull on each other. The tendons would try to assist the muscles and do their job, and they just literally felt like you were being ripped apart in the groin area. A very uncomfortable feeling, a feeling that persisted for hours on end, took sometimes days to settle down. The only relief I could get was to take an anti-inflammatory that was prescription, ice the area, and that seemed to settle things down. That over a period of a couple of hours of icing and letting the anti-inflammatory kick in, I would get some relief. The third type of pain was pain associated with prolonged activity. I was committed to try and keep my legs in as good a condition as possible. I wanted to go into the surgery strong and with as much muscle tone as possible, so I adjusted diet to account for that. I started to do exercise routine pre-surgery to assist with my leg strength. But if I went for a long bike ride or tried to engage in kiteboarding, I paid dearly. And some of the household chores, as simple as cutting the grass or climbing a ladder to do some painting, became impossible. In fact, walking became a real difficult task. So some of those things I just simply avoided. Anything where my body weight was fully compressed on the hip joint, considering the hip joint was really a bone-on-bone scenario, I paid dearly for. And I couldn't get much relief. The anti-inflammatories took too long to kick in, and there were side effects to them that I was concerned about. They can cause damage to the liver and damage to the kidneys. So that wasn't really a good sort of solution to the problem. I tried physiotherapy with really no result. My bike rides did more to help than the physio. And the other pain med, because I didn't want to get into the Oxycontins and the morphines, was simply a Tylenol 3. It was prescription, but it didn't really work that effectively for me. And as I mentioned earlier, I tried 2 hip injections, cortisone injections, which didn't do anything at $600 a crack. I wasn't prepared to continue to do those because they really didn't work that well. So it was a combination, when it really got bad, of using the Tylenol 3, the anti-inflammatory, and ice therapy. They seem to work in combination to do the best job at reducing the pain. But the pain was always there, and that's what I'm looking forward to come end of day tomorrow, is to be rid of that pain and introduce what I hope will be just a short-term pain relief solution.